Well, I think, first of all, it's just so complex and multifaceted. Overarching it is this tension between what is the role of government in helping people get access to coverage. It's in the view of someone with the public health lens and prevention, it's about whether we will see that having access to health coverage is really the way in which we help prevent disease and keep people well.
We hear
It's
about
economic.
we hear about that. Let's talk about that for just a second. We hear about that a lot. Do you really? Can you see a day when we are a healthier country because we've actually taken preventative steps seriously? When we're not struggling with weight, not struggling with diabetes, not struggling with heart disease, because we've actually we don't do anything on the front end almost. We operate on crisis mode as a society so much. Do you see a day when that can actually happen?
I see a day when we see that there's both the primary prevention, which is seeing that health is in all aspects of our life, and that means changing the way in which we design our communities, changing the way in which we eat, all of those sort of personal behaviors that are influenced by how we structure it. But then we also know that throughout the Affordable Care Act, there are many provisions for having prevention of disease by allowing people to get colonoscopies, to get mammograms, to have well woman coverage at no cost to them. And so when the insurers, the private insurers, are forced to make sure that prevention is key in their delivery system, that is another secondary step in that whole prevention continuum. And if we integrate both that primary and that secondary prevention, yes, I see a day when we can be a much healthier world and state, and actually St. Louis region particularly. I think that what is missing for people right now is that access to consistent primary care. And we know that relationship is critical in helping people really have prevention in their lives.
Chris just talked about the incentive a hospital has. How do we change that incentive to do what you're talking about? Can that be done? Do they have to be incentivized, or does it have to be legislated?
I think the hospitals, the whole healthcare delivery system is going through this transformation. Again, the Affordable Care Act has specific provisions for accountable care organizations, for really changing the way we deliver it. But if you look at the community outreach and the work that so many hospitals in the St. Louis region are doing, and actually throughout the state, I think that everyone understands that it is more cost-effective, and it is certainly better from a human standpoint to be sure that we're doing prevention.
And that kind of goes back to what you started to say just a minute ago, which is the economics of this. How do you see that playing out in a state that does or does not expand Medicaid? We'll talk about tonight's topic. If we don't expand Medicaid, what are the economic consequences?
Well, I think that we've already heard that there's two sides to this coin. There can be some incredible economic benefits. The study that cited that just in the first year alone, possibly 24,000 new jobs from doing this expansion. But there's also the very dark negative part, which is that we may have hospitals closing in rural communities, even in St. Louis, where I think someone talked about the fact that the larger hospitals will adapt. The study that was done by the Missouri Hospital Association gathering data, they're predicting that we could lose up to 3,000 jobs in the St. Louis region alone just by not doing this expansion over the next several years. And so this is really part of whether we continue to provide good support for our healthcare delivery system. And I think finally from tonight, we just have learned it really is a human story. Your last group of individuals really talked about people they know who go all the way to England just so they can get health care coverage consistently, the person who's working every day but just can't get insurance. If we don't do this Medicaid expansion, if we don't cover more individuals, we know that next January, the person will be facing the same grim health care situation as they do today. They can't get their flu vaccine and may lose lots of time from work. They don't get their blood pressure checked regularly. And finally, they just don't have somebody there regularly who cares about their health and can help them.
If you look at this strictly politically and kind of from without maybe, or predictably politically, it looks like there's no way we'll expand Medicaid in the first year of this, the opportunity to do so. But then we heard from Jim and Joe and Jason talking about how, and you just mentioned again, the impact in the rural part of the state. Do you see different lines being drawn in versus other issues we might see, Republican versus Democrat? Could there be different battlefronts, if you will, that emerge from this that could actually get this passed or get this close to some sort of reality?
Well, because it is so complex and because the whole legislative process has lots of moving parts, I'm being optimistic. And I think that that threat, frankly, of what could happen in the rural areas and just to our overall healthcare infrastructure without doing this additional coverage, I think may be enough to start changing some minds. But I think taking a long view is, even if it's not done this year, I think most states, including Missouri, will find themselves seeing that this really is the smart thing to do, and it is the right thing to do, because if you look at the whole history of Medicaid since it started in 1965, it has been these incremental expansions, and I think that this is a new area. It does include people that we haven't often thought would be on Medicaid, but it is a fundamental belief of people in this country that everybody should have access to health care. And so I think that ultimately Missouri will join with other states and we will see these people covered.
We have just a few seconds for me to play devil's advocate. But we can't trust that that money will really be there, and the smart thing to do is to look out for our own state finances, is what some of the opponents will say. Do you buy that argument?
I think that because of the way the Supreme Court laid this out, with it being a voluntary program, that what Governor Nixon has proposed, which is similar to what Illinois says, is we will keep our commitment and cover these people if you keep your commitment in terms of the funding in the federal government. If not, we will be able to adapt to that.
Thank you very much. I appreciate your time.